3, 2, 1, go.
This skill is designed to evaluate your ability to provide spinal immobilization to a sitting patient using a half-spine immobilization device. You arrive on the scene of an auto crash with an EMT assistant. The scene is safe and there is only one patient. An assistant EMT has completed the scene survey as well as the primary assessment, and no critical condition requiring any intervention was found. For the purposes of this evaluation, the simulated patient's vital signs remain stable. You are required to treat the specific isolated problem of a suspected unstable spine using a half-spine immobilization device. You are responsible for the direction and subsequent actions of the EMT assistant. Transferring and immobilizing the simulated patient to the long backboard should be described verbally. You have 10 minutes to complete this skill. Do you have any questions?
Nope.
Right. You may begin.
Okay, I'm wearing my BSI, my gloves, my eye protection. I'd like you as my assistant to place the patient's head and spine in a neutral inline position and maintain manual stabilization of that until she's fully secure onto the long backboard. Okay?
Yes.
I'm going to check her CMS times 4. Do we have good equal pulses?
Yes.
Okay. Squeeze my hand, please. Okay, and you can feel me touching? Okay. And what about her pedal pulses?
She has them.
Has them, okay. And can you wiggle your toes? And you can feel me touching? Okay, so she's got good CMS. I'm going to size and apply a collar. Before I do that, I want to palpate and inspect her neck. Do I see any deformities here?
None.
And when I press, can you tell me, does anything hurt especially? Okay, so I'm palpating and visualizing as much as I can. I'm going to size her. She actually looks like a regular, so I'm going to have to adjust this collar. Lock it in place. I'm going to put this collar on you. It's going to help keep your neck stable, okay? That looks like a good neutral position right there. Okay. All right, you can breathe okay?
Yes.
All right. Now I'm going to go ahead and place the immobilization device on her. Okay, so I'm going to kind of need your help here. Now what we're going to do is I'm going to have you in one motion. We want to keep your spine as straight as possible. I'm going to have you just lean forward real slightly so your back is not leaning against the back of the chair. Okay, perfect. And we're just going to hold that right there. And actually, if you don't mind, can you kind of maybe rest your arms on her shoulders a little just for now. I'm going to slide this device in behind you. There you go, just whatever you need to do there. And I'm going to put these under your arms here, these wings of the device. Okay, and I want to make sure that my leg straps are all set up. Okay, perfect. So, I'm going to secure the middle strap. This looks like a brand new kit. Just more or less hold still. I'll work around you here. Also, excuse me. Just kind of work it underneath. Okay, now what I need you to do is just kind of take your shoulders and put them back like you're trying to maintain perfect posture. There we go. Need a little bit of padding behind your head there. And maybe one more. There we go. Okay. And now we're going to secure your head to the device. Now that your torso legs are secured, let me just reevaluate this, make sure it's good enough. Okay, these are both good. Alright. So, let's put it on your forehead. Okay, good. Now I'm moving these all the way around. And there's actually one that kind of comes on your chin here. Want to make sure once we put this on, you can still open your mouth. All right, so can you open your mouth for me? Okay, good, good, excellent. All right, so we've got padding all the voids. We've got her in a neutral inline position. We've secured the torso to the device. We've secured the head to the device. The leg straps are in place and secure. And what I would do at this point, I'm actually going to check her CMS. Good pulses?
Yes.
Squeeze my hands. You can feel me touching. Good pulses?
Yes.
With your toes? You can feel me touching. Okay, so at this point I would put her onto a long immobilization device. The way we would do that, we would take the backboard, we would slide it under one buttocks there, kind of work it in there. I'd have you maintaining manual stabilization of the head, and myself and or another person would help rotate her so she's in line with the long axis of the board. We would gently lay her down and then loosen those leg straps so that her legs could lie down flat. And extricate her. If we could put the spider straps on at that point, we would. If not, we'll wait until she's out of the vehicle and then put on the spider straps. So once we've done that, we're going to reassess CMS times 4. Still good pulses?
Yes.
Squeeze my hand. You can feel me touching? Okay. Still good pulses?
Yes.
Wiggle your toes. Okay, you can feel me touching? Okay, good. And I am done with the skill station. One thing I could do, but I don't need to do because I've got good new straps here, could have taped her head and used tape in addition to or instead of these devices, but this is a brand new kit and these are adequately securing her head.